Hey, good evening, everybody, and thanks for joining us tonight for a COVID-19 update and a vaccine review and a chance to get some good, helpful information, but also ask questions. We have a few folks from the fund office joining us tonight. Tim Wolf's going to help manage the whole presentation, and Regina, our administrator, is here as one of our subject experts, as well as John McHugh from Uprise Health, HMC HealthWorks. And John's got a lot of experience in the health benefits field, and specifically, in the last 2 years has been very helpful around this issue. Now, we've all heard way more than we ever wanted to about pandemics and COVID-19, and wish this was far, far in the rear view mirror. But, the good news is I think we're close to that point, but we've got a little more ways to go here, and we want to make sure that we wrap up this pandemic and get it behind us in the safest way possible. It's been a tough time for our members and all the different industries they work in, but the best way to beat COVID-19 is with good information, facts, and you're not going to find that on social media and all the wannabe experts who tend to get things a little mixed up and confused and can do some damage. So for that reason, I want to welcome John. And before he jumps in, Regina, if you want to tag team me there and pick up on continuing to introduce John and get us rolling through the agenda tonight. Thank you.
Thank you, Wendell. Thank you. And good evening, everyone. Thanks again for joining. So we are very fortunate this evening to have a great speaker to address the topic of a COVID-19 update and FAQs regarding the vaccine. John McHugh serves as Chief Pharmacy Officer for Uprise Health, HMC HealthWorks, which is the fund's disease management, condition management vendor. So John is responsible for proactive medical pharmacy management efficiencies and integrity of clinical operations in connection with the company's strategic initiatives. Now, prior to joining HMC Uprise Health, John was with Optum RX for more than 23 years. And as you may recall, Optum is our PBM for the fund, and it's one of the first or either the largest or the second largest PBM in the country. And he has held multiple positions at Optum Health, including clinical and management positions, which include client support, and has been an extremely trusted and highly valued expert on all issues pharmacy and COVID matters for us at the fund office. So we are very, very fortunate to have him join us. We look forward to his presentation this evening on COVID-19 update and vaccine review. Thank you, John. Please take it away.
Thank you, Regina. Thank you, Wendell. It is hard to believe, like you said, it's 2 years. We've been at this for 2 years. We started not knowing very much at all. We started very timid and afraid of what was going to happen. And I'll tell you, the first time I ever got a microscopic picture of this virus, it scared me. It looks ugly. And those spikes, those protein spikes on the virus are the one thing that the vaccines all have in common, because what the vaccines do is they take an image of that spike and they put it into the cell, and our bodies can actually then recognize this virus when it comes in, when we come into contact with it, when we get exposed to it, and when it tries to get in and replicate in our system, which gives you the COVID disease. So let's get into the slides, and just, I'm going to take it slow, and anyone can on the screen can let me know if I'm just getting a little bit too technical, because I'm going to try and stay away from that. So when we start, the first thing that we've been looking at now with the Society for Health Resources, they wanted to find out what was the main factors that were causing employees or people in general not to get vaccinated. As you can see from this chart, the top 40% and higher, is all that they just don't trust it. They don't trust that it's safe or it's effective. It got to the market too quickly. People are very skeptical. And in fact, that was one of the challenges we had early on, trying to get people to accept the vaccine. So they don't trust the vaccine, they want to wait and see, or they're concerned about the possible side effects. We've learned through experience with all the vaccination and inoculations that have happened that clearly the side effects are nothing compared to the disease itself. So we have had success in getting vaccinations with the public service, from the states, from the government. We're getting into a situation now where we do have significant people fully vaccinated. And when you look at the number of those vaccinations that went into the arm, it's very promising. So we're going to start to go through the slides and just talk briefly first, what are the benefits of COVID-19? Everybody has heard it. It's on the TV, it's in the papers, it's in magazines, it's everywhere. You're reducing the probability of hospitalization and mortality. And mortality means, yes, this virus is still a killer. It can also prevent you from spreading the virus to others. It reduces what we call a virulence factor. And that means that the virus can replicate itself and take over control of the body and spread its effects. So you get the dual benefit with vaccination. It prevents it from replicating. And when that happens, the more replication it goes through, it tends to mutate. And then it does have a potential to be resistant to vaccines, but we've been very fortunate. As you know, we started with the Delta variant first, and that was, again, more contagious and more virulent. So what would happen is everybody was afraid, even if they had the vaccine, that they could become infected. Well, it turns out that those vaccines with the spike protein was enough to protect it, because both the Delta variant as well as the corona are definitely the same, and the vaccines are effective. So the other effect that we have to realize from the vaccines is that you're helping the community, your coworkers, your neighbors, your friends, your family. You're going to work to reduce the spread of the disease because of the vaccine that you get. So everybody really needs to be focused on the possibility of getting the vaccine and all the different variations of it. So if it's an mRNA vaccine, then you're going to need 2 injections. If it's the Johnson & Johnson, you just need 1. So in the beginning, this was not fully approved by the FDA. There was an emergency use authorization, an EUA. Everybody was very concerned that there was a shortened process and they skipped a lot of safety factors. That is not true. There are 2 separate advisory boards that advises not just the FDA, but also the CDC. And then remember, both of those organizations review all the data and make their evaluation on the data also. It does not, the EUA does not imply at all that authorization was done too quickly or the vaccine safety was pushed at all. And when we look at the EUA, everybody wanted to know, how did we get it from development right into production, and we could get it out into all the different sources for distribution, and then get it to the pharmacies and to the clinics and to the hospitals, everywhere to get the injections. Well, the process that helped to speed this along was a change in the normal process that vaccines went through. The research in initial development was the same time. When they started testing and they started to see that the testing was successful and it was blocking the virus, they began manufacturing and development at that time. Well before the approval was there, that time being able to manufacture, they were so confident in its results that they began to manufacture and felt that it was appropriate to start it, so that when it was approved and delivery was available that it could get out into the community, and we could hit our most vulnerable population, which is what we did first. We looked for those over the age of 65. We looked for those with multiple conditions, or we call them polychronic, where they might not just have diabetes, but they have hypertension, coronary artery disease, or heart failure, heart issues. Those people had to be very cautious, and it would really put them in the hospital, in the ICU. So being able to get the medication out and then start to go through the different subsets of the demographics, going first by those that were most vulnerable down, it really helped to get the vaccine into the arms quickly. And if you look at the little picture over here on the side, the emergency use authorization was allowing it to get in before it had full authorization. But if you look over here, there was full FDA authorization. Look, I have a typo. It's 2021, August of 2021. Pfizer received full FDA approval, and the Moderna just got full approval at the end of January. So clearly, all the data that was compiled after this vaccine was out and being administered, it really proves that the process we went through did not push safety aside, and it was an extremely in-depth process to vet this vaccine out. So today we have 3 vaccines that can be used. The Pfizer is one that has to be taken 2 shots, 21 days apart. The Moderna is 28 days apart, and they're both the messenger RNA, which we'll go over in a minute. And the other one is the Johnson & Johnson vaccine, and that's only 1 dose. And the Johnson & Johnson is also the one that it can be used right now for the children. So we've gone through the process of getting first and second shots and becoming fully vaccinated. Everybody wanted to know now, well, what about the boosters? So people realized that as time went along, 4, 6, 8 months after your second injection or your first with the J&J, that the ability to protect against the virus started to go down from the 95, 94%. After 4 to 6 months, it could drop to 75. And then a couple of months beyond that, it can drop even more. But remember, each of us are individuals, and our immune system are individualized so that everybody reacts differently to it. But clearly, we needed to take a look at the boosters. And I'm very happy that we did. One of the things that I wanted to mention about the boosters, right now, the coronavirus is really starting to make its way into the United States. And it's starting to become a prevalent cause of the COVID-19 virus and infections. Well, what we found out is those people that had boosters, and I'll finish with some statistics on that, about over 44% of the people received boosters, which is lower than what we saw with the initial immunization. But clearly those people that got boosters are predominantly those at highest risk, and they are the ones that are safe from the variants as they come along. Because the variants, although they might be different in a little bit of a structure, that spike protein is still the prevalence in that virus, and the vaccines have already identified that and put it into the vaccine so that your body can recognize it the minute that you're exposed to it. So the COVID-19 vaccine from both Pfizer and Moderna is messenger RNA or mRNA vaccine. So everybody was concerned when this first came out that you're talking about mRNA and DNA, it's going to put something in your body that can affect your DNA. And I want to just let you know that right now, there is no way that a messenger RNA, and that's ribonucleic acid, can get into the nucleus to affect your DNA. If you remember the picture from your old science, wherever you were able to see that, the cell and the cytoplasm and the mitochondria, the nucleus was in the center, and that contained all of our individualized DNA. Well, this mRNA vaccine actually goes into just the cytoplasm and then releases that identity to identify the spike, and then that is then worked on by our immune system so that it now recognizes that that spike protein is a virus and it needs to be attacked. And that's how the mRNA vaccine works. So building the antibodies, remembering to fight that virus because of that spike protein, that is a wonderful technology. And mRNA processes has been in science and in the pharmaceutical companies for 15 years. It was used back for Ebola a few years ago. And this is the new technology that can be used today because our science is just going in leaps and bounds and getting better and better. So the big question too is, can this vaccine give me COVID-19? No, it can't. There's no active COVID-19 virus in any of these vaccines. And is it going to change the DNA? No. The next COVID vaccine from J&J is called an adenovirus. This is where the drug company takes a virus like something that would give you a cold or something like that. It's called an adenovirus. And that is manufactured. And again, it's identifying the spike protein. And then it goes into the cells. Again, it doesn't get into the nucleus or anywhere else. It just gets into the cell to identify that spike protein for our immune system. And that's wonderful because, again, it identifies not just the COVID-19 that we started with, it went through the Delta, now through the Omicron, and we are following, and we're definitely tracking to take care also and protect from the variants that are coming up beyond. Again, viral vector, these vaccines cannot give you COVID-19. There's no COVID-19 virus in it. And again, it's not going to touch the DNA and has no virus content at all. On this slide, I just wanted to show you that there's more than the active ingredient in the vaccines. So the vaccine is the adenovirus or the mRNA, but you need to stabilize that solution. You need to protect it from the refrigeration. You need to protect it from length of time so it remains stable. You have to set the acid-base content, which we call pH of it, so that it can be handled by the body. And that depending on the temperature that it has to be, the Pfizer is frozen and Moderna is not, but Janssen is a little bit easier. It's just refrigerated. So all of this is put together so you have a stable, sterile, safe vaccine that can be held and used at distribution points throughout your communities. So COVID-19 vaccines, any side effects? Yes, there are going to be side effects. You have to remember that these vaccines are jolting and initiating an immune response in your body. The body is a wonderful thing, and the immune system is what's used to attack and treat viruses. So when a vaccine is introduced into the body, that starts the immune system working. And the most common side effects that we see for all of the vaccines are a tiredness and a pain at the injection site. Sometimes there may be a fever or chills. The way to handle that, and it is generally clearly marked wherever you received your vaccination, is that Tylenol, acetaminophen is great to be able to reduce that fever. And it is only for a few days. They usually just 24 to 48 hours after you have your injection. For most people, these side effects, which are minor compared to the getting the virus itself, it's a very inconvenience. It's an inconvenience, but it's not something that is going to stop you from being able to do your daily routine. So you can apply a wet washcloth and exercise the arm that you had the injection in, reducing discomfort from fever. You want to make sure you drink plenty of fluids and you dress lightly. You don't want compression on the area where you had the injection. Plenty of fluids, make sure that you're hydrated, because one of the side effects of dehydration is also fever and a feeling not well. If any of these side effects that linger or get worse after 24 to 48 hours, you're always urged to call the doctor if you feel that it's more than what you would have imagined. The serious side effects from the vaccine are rare, and they're in a very small percentage. And again, the risks that come along with the vaccine far outweigh the benefits that you get from not being hospitalized, ending up in an ICU, and God forbid, passing from
Hey, John.
contact. Yes.
Maybe I misheard you, but you may have reversed that. I think what you meant was the benefits of the vaccine far outweigh the risks. Maybe you want to repeat that.
Yes, thank you. Thank you. Let me repeat that and bring that to my attention. Yes, the vaccines, our benefits far outweigh the risk of getting the virus. Clearly, I reversed it. I apologize for that. Thank you, Wendell, for picking that up. The benefits are far better than the side effects or the risk of side effects. On the next slide, during vaccination, there has been a great amount of documentation and follow-up. CDC has started a V-Safe program where they actually will follow up after and during the vaccination. So you enroll with this with your phone, and it is text messaging that goes back and forth where you can report how you feel after the vaccination. Remember, the safety protocol that went into effect with all of these vaccines was that you didn't get the injection and then were able to leave. You had to stay for at least 15 minutes to 30 minutes to be watched to make sure that you didn't get a severe adverse reaction. And it is one of the first times that I have been in clinics where I have seen the EpiPens at every site there, just on the chance that someone may have a reaction to it. Those people that didn't realize they were highly allergic, that there was that ability to take care of it immediately. So it's important to note that the type of vaccine you received, the date you received it, and where you received it. And then reporting this on V-Safe are those people that did the vaccination. So it's always good to have that and bring it for the next shot if you're on a 2-shot protocol, so that they can add that in. There's also a possibility that you can get reminders if you need a second vaccine. So the CDC was very, I think, being proactive in making sure that there was an easy way for those patients who had these vaccinations to report anything that was out of the ordinary or an adverse reaction. So let's take a look at some of the summary considerations. And thinking that this is now 2 years that we've been through this, the current COVID-19 vaccines that are available today are safe and effective. over 217 million people in the US are fully vaccinated. That means they either got one J&J or they got two of the Pfizer and the Moderna. That's over 65% of the US population. And this was from the CDC site just on the 21st. Over 96 million people had the booster. So we can see it's only 44%, not even 50% of the population has received the booster, because I believe we have seen less anxiety over that. But still, I think it's important for those people that are at risk, those first line workers, to make sure that you can be as protected as possible so that you are safe as well as your family and your community. So if you look at the total vaccinations administered, that's shots in the arms, over 558 million shots. They do go through the safety monitoring, like I said, with the CDC, and definitely the vaccine still outweighs, the benefits of the vaccine still outweighs the risks. Oh, I'm glad I put that in there twice. The total cases that we have today of the virus, just short of 80 million. And the total deaths are closely approaching 1 million, 969,114 to date. So we are having the benefit, not just of the vaccine, but of also the treatments. We had the monoclonal antibodies that can be used for those people that get sick to prevent them from becoming hospitalized. Also, the monoclonal antibodies were infused product, and that meant you had to go to a site to have it infused by a healthcare professional and an infusion site. Now we have two antivirals that are oral that can be taken and received from the pharmacy. So that's helping us, and that's on the side. It doesn't actually replace the vaccine, but it is a safety feature that is there to help catch those people that may have contracted the virus and without vaccination, and they can recover without having to go through hospitalization and draining ICU beds. So although employers may mandate it, most organizations are still trying to incentivize employees. There are some municipal workers in some of the cities and states that are mandating it. That mandate is now being lifted, but we had 6 to 8 months where certain cities workers had to be vaccinated, and there were people let go because they weren't. But the CDC has guidance by industry to help anybody create a safe workplace and health environment. It's important that we still continue to use the safety measures of both masking and social distancing if in enclosed spaces, because we may not be certain who may or may not be vaccinated. And the last thing that came out is a lot of the employers may be mandating on certain work sites. Some of the building trades are especially on that. An employer may inquire about the vaccination status of their employees without fear of violation of any employee rights. So that was put in there because there were very many people that were worried that there was intrusion. But when you're looking at the safety of the whole, being able to get status of vaccination in enclosed spaces is very important. So at the end of this, I just wanted to let you know in the summary considerations, over 255 million people had at least one dose. So that's almost 77%. And that's a very good number. I don't think we ever thought that we would get there. But at this point in time, we're very fortunate that more and more people are stepping up and accepting the vaccination. So there are some resources in this slide deck for you to consider. As Wendell mentioned in his opening comments, social media, Google, the internet is not a reputable scientific place to get clinical information. When you need to follow the science, go to the original organization that has spent all that time and resources. It's the CDC, it's the FDA, and it's important. Health and Human Services also has a great deal of information there. There's also a phone number that is available here that allows you to make a phone call and find out about a vaccine or get some information if you don't have a computer or a phone that you want to connect with the website. So that's the extent of the slides I have prepared. And I believe at this point in time, we were going to open it up to questions. Tim?
Yes, that's right. Thank you, John, very much. We do have a few questions here, so I'll go to the first one. So I heard about a new variant. Will the vaccine protect against that?
Yes, it's the SB.2. And right now it's in Europe, and they expect it to make its way to the United States, especially since a lot of the travel restrictions and some of the masking mandates have started to become lifted. It will show up here, but first glance at it has found out that those with boosters are a lot safer with the new variant that's coming up. But again, the vaccines are proven to be effective against it. So it's a good thing to realize. But again, if we get a surge of that SB.2, then I would strongly recommend that we actually go back to masking and social distancing to protect ourselves.
Okay, great. Someone also is asking if the vaccine will prevent me from getting the flu.
No, I really wish that was the case, but I believe it was on my second shot. I got the flu and the COVID-19 because they could be given at the same time. The flu does not currently, it's not protected by what's in the COVID-19. COVID-19 vaccine is specific to that. The flu vaccine actually mixes different types of flus. If you remember in the past, we had H1N1, we had aviary flu, we had the bird flu. The CDC and the FDA and the drug companies all work to put that together year after year with different strains in the hopes that it would be effective. So it can't stop you from getting the flu. You still need your flu shot. And please do go out and get your flu shot because it is surging a little bit. As we stop masking and social distancing, we start to see the flu increase in communities.
Okay. So we have a question here about the booster. Will we need a fourth booster shot?
Well, in April, they are convening a committee to talk about that. I believe they will take a look at the time constraints, the 6 to 8 months. If we can get to the better weather, I think before another surge comes through, they might say that it could be optional. But I do believe that there may be a need, maybe sometime in the summer, early summer, to get a booster. But it's still under advisement, and the team and the clinicians and the physicians will be working on that.
Okay. So someone here is asking if you get vaccinated, does that mean you can go back to normal, quote unquote?
Yeah, everybody's talking about the new normal. I don't think we'll ever get back to that. Everyone's still just going to be a little cautious about when they get into a congested area, how comfortable they are. I don't think, movie theaters have opened up, restaurants. I believe if you're vaccinated, you have a chance of getting back close to where you were. But in tightly congested inside spaces, I think there's still going to be some, I would say, caution about not being masked or putting yourself in that position.
Let's see. We have a question about, okay, so if you've had COVID, do you need to get the vaccine?
Yeah, so if you did get COVID, especially in the early days, it was before the Delta variant. So what happened is your body built up an immunity to that you received, the virus that you were infected with. Some people that are unvaccinated and had COVID-19 didn't have it just once, but they had it twice. So the protection you get from having the virus is not the same as a vaccine. The vaccine has a higher percent to protect you against not just the existing virus that's there, but any of the variants and the subvariants that will come after that. So still, it's recommended, even if you've had COVID and you did have some protection after you recovered from it, you still should get vaccinated.
All right. We have one more question. It looks like here, this person's asking about the effects of the COVID vaccine on fertility, if any.
Yes. So early on, it was very, it was spread around quite a bit that those people that were planning on having a child, or those that were pregnant, that they didn't want to get it because it might have affected the ability to get pregnant or issues to a pregnant woman. OB/GYN groups got together, they've reviewed everything. There have been numerous women pregnant who have given birth to healthy babies and have not had an issue with the virus. And there is no clinical data that shows there was any impact at all, that there's any impact at all on our fertility and or issues with pregnancy.
All right. All right, thank you. That is, looks like the last question. So I'll hand it back to Regina or Wendell if either of you have any closing remarks.
Virginia, do you have anything?
I do, Wendell, thank you so much. I just wanted to remind our participants, number one, that we are there for you anytime you have a question or concern about your benefits generally, and certainly the COVID vaccine and plan coverage for the COVID vaccine, or if you unfortunately are to get COVID, please call us. Where there's a resource, we want to help you. That's our only reason for being in existence. And I also wanted to remind participants that free test kits are available, and I say free, so you can get them for absolutely free, no cost to you and no cost to the fund, through the government. And we issued a communication recently to show you the where you could get those, order those online. They'll be delivered to your home by the Postal Service, which is a great benefit. And then in addition to that, they're also available to you at no cost through your coverage under the fund if you purchase the COVID-19 home test kit at a preferred pharmacy. And it's not our normal preferred pharmacy network. There's a special COVID home test kit network that is available, and it includes Rite Aid and Walgreens. So it's a great opportunity to protect yourself and your family, and to be responsible to your community, to order some of those test kits, to have them on hand. And again, they're available very easily, 100% free for the post office, and no cost to you through the fund. The fund will pay for them, but you don't have to pay anything. There's no copay if you use Walgreens or Rite Aid to get your test kits. If you go to another pharmacy, say if you went to a CVS to purchase your home test kit, we will reimburse you up to $12 per test. But no more. If it costs, obviously, if it costs more than that, you would be responsible for the additional cost. So there's a great incentive to use either Rite Aid or Walgreens for your home test kit. And please do the right thing, protect yourself, your family, your coworkers, and your community by having those test kits available and taking the necessary precautions. Wendell?
Yeah, so let me just ask a question. First to Regina on tests. What if before the fund announced the free test kits, people bought tests, maybe they went online or went to some pharmacy and bought them. Is there a way they can get reimbursed?
So I'm happy to call out a great decision making by the trustees who early on took the steps in view of the pandemic to protect our participants by waiving many of the cost sharing features of the plan for diagnosis and treatment of COVID. So those protections were in place through September 30th, 2021 for any participant who incurred an out-of-pocket expense for something that would otherwise be covered by the plan. So hear about these kind of, as John mentioned, there's stuff on the internet where people are saying, take this drug, it'll protect you from COVID. So if it's not a drug that's covered by the FDA and is valid for the treatment of COVID or protection from COVID, the fund won't cover it, it'll be denied. But for things that are medically necessary and covered by the fund, if you incurred an out-of-pocket cost through September 30, 2021, that cost will be waived. So you submit the claim to us and we'll let you know if we can waive the cost, and we're happy to do that. In addition, effective October 1st through December 31st, 2021, the trustees further waived any cost sharing for diagnosis and treatment of a COVID-related condition if the participant was fully vaccinated. And so they're, recognizing that the vaccines were widely available beginning probably earlier than October 1. But the trustees said at that point, anybody who's doing the right thing by getting vaccinated and can get vaccinated, we want to further waive any cost sharing if they are unfortunate enough to get the vaccine or the, COVID illness anyhow. If they have any out-of-pocket costs, we'll waive that cost. So if you are one of those folks who was fully vaccinated after October 1, unfortunately got COVID and incurred out-of-pocket costs, we have a process in place to reimburse you for the out-of-pocket costs. So call us, we'll walk you through that process to help you get reimbursed. Or prior to October 1st, 2021, if regardless of whether you're vaccinated or not, if you incurred costs out of pocket for COVID-19, if it was an otherwise covered fund, a service, we will reimburse you pursuant to the cost sharing changes that were put in place by the trustees. Sorry, Wendell, for the long explanation, but.
No, I think it's a good question for everyone to understand, and for our reps that are participating or will view this later. I want to make sure they know how to advise our participants of our fund. John, a lot's been happening with testing, and we saw the panic with Omicron in December to acquire tests. What are your thoughts about people looking forward from today about ongoing testing, routine testing?
I believe routine testing will continue. It's important that if someone does feel that they might have it, testing to then be able to isolate for at least 2 or 3 days makes total sense. You don't want to risk the chance of going and affecting other people around you. Even masking, if you have an active case, is not really advised.
So what we're doing, I just want to use Local 1776 as an example of why I think testing is important. Our most of our staff are in the field. They go into workplaces that are, often many people under one roof. If it's retail, not just our employees, but the hundreds or even thousands of people that move through those places daily and weekly. We don't want them to contract coronavirus, and we certainly don't want them to be the one that spread it from workplace to workplace. So, we've had some pretty strict protocols for them in terms of, masking and other sanitation and personal sanitation issues.
Yep.
But we've also, back this past fall, acquired tests before the government made them available to everybody for free, home test kits, and began a weekly testing program and tracking. And, I honestly say that while we haven't had people that contracted it each week, we've had a handful since that time that have gotten it. Now, some have had some uncomfortable symptoms like any tough flu. Others had no symptoms, didn't even know they had it. And while they were fortunate to not have many symptoms, I can't help to think that if they had continued without that testing, going from workplace to workplace, how many other people they could have spread that to. And some of those people may be taking it at home where there's someone with a compromised immune system or other serious complications. So we've made the decision to continue testing through April. Our staff has to test at least once a week or more often if they have any symptoms or are concerned about a contact. We have a reporting process. I really feel it's not only helped keep our employees safe who work out in the field, but it's kept our members safe who they interact with, the people in the community they interact with, and their families. So I encourage it. As I said, we've had a handful, and prior to that, we had people that had symptoms, went out and got a test, confirmed they had it. But I'm talking about people who didn't know they had it, who tested positive.
That's scary.
And I just encourage people now that the tests are available, our funds are paying for it. Go to the pharmacy, get a handful of them, get what you're eligible for. At least once a week, just check it. We're also encouraging people, but also requiring our staff, to track those stats that are available, that are tracked by county. Since they don't just go into one county, if they're going into a busy workplace, we want them wearing masks, even though those mandates aren't in place. What we've talked about with everybody is if you're in a situation where you're in close contact with a lot of people, put a mask on. Just because masks are off, we still want you to have one, a couple extras in your briefcase, your pocket, put them on. Don't take the chance, don't risk it for yourself, your family, and your community. So that's all I have for now. I want to thank everybody. If anybody has anything else, last chance, questions, comments. Okay, John, I want to thank you for taking the time to talk with our folks about this. This will, as you know, it's been recorded, so we'll make it available in our library and use it for some training with staff. Tim, great job producing, and thank you, Regina.
My pleasure. Thank you all.
Thank you, Wendell. It's been a pleasure.
All right.
Appreciate it.
Take care.
So long. Stay safe.